UlizaDaktari, brought to you by CIC Insurance Group.
Keep your family protected with our Family Medisure cover at an affordable rate. Our Seniors Golden Age cover is now more comfortable with Seniors Mediplan cover. And for 4 or more members and their families, Corp Care has you covered. CIC Insurance Group. We keep our word.
Tulikuwa in shock wakati daktari alituita ndani akaanza kutuambia it's too bad to take long, tungejua tungekuja mapema, but cancer was the last thing tulifikiria naweza pata juu hata sikunywi pombe, sivuti sigara nini juu wengine huwa wanasema maybe kama chakula unakula pia inaweza cause cancer.
Colon cancer is a type of cancer that develops in the large intestine. It typically affects older adults, but it can occur at any age. Now, according to the Global Cancer Statistics of 2022, colon cancer is the 5th most common cancer in Kenya. There are over 3,000 new cases reported every year, with over 2,000 deaths. Saratani hii hupatikana zaidi kwa wale wenye umri uliopita miaka 45, historia kwa familia, ugonjwa wa sukari, wale ambao hawafanyi mazoezi ya kutosha na wanaotumia sigara na pombe kwa wingi. The symptoms of colon cancer include changes in bowel habits. Now, patients may have diarrhea or constipation, persistent abdominal discomfort, or a feeling that the bowel doesn't empty quite completely. Rectal bleeding or blood in stool, unexplained weight loss, iron deficiency anemia, as well as features of intestinal obstruction. Colon cancer treatment options will include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Good evening. My name is Dr. Lauren Mengesta. Mimi ni daktari wa kina mama. Thank you so much for tuning in this evening on UlizaDaktari. Our focus today is colon cancer, and our case study this week is Martha Muga. Let's listen in to her story.
Mimi nilikuwa mwathiriwa wa saratani ya matumbo yenye inajulikana kama kansa ya colon. Nilikuwa na feel kama niko na constipation ile ya back to back, so singeweza hata kupass air, nikaanza kufura tumbo, nikaanza kuogopa kula, sikuwa nakula. Sasa tumbo ikafura na mwili nikaanza kuwa mnyonge na pia nikaanza ku lose weight. Sisi at first tulikuwa tunadhani ni constipation, lakini haikuwa constipation. It was more than constipation. Every time nikienda hospitali nilikuwa napatiwa 2 stool softeners, na pia naambiwa kunywa maji, kula roughages, kumbe ilikuwa more than that. Sasa nikawa natumwa kufanya test mingi, nikaanza mara naenda ultrasound, nikatumwa MRI, nikatumwa CT scan, hizo zote hazikuonyesha. Ikafika mahali sasa nikawa na lose mpaka saa zingine na hallucinate juu ya pain. Sasa nikaanza kukua na ile pain yenye siwezi niseme that is cancer pain, because it is a very different pain. Sasa ikafika mahali tukasema wacha tufanye, nikapatana na nurse. Sasa huyu nurse ndiye akanipatia mwenye anahusika na digestive system. Sasa ndio nikapelekwa nikafanyiwa test yenye inaitwa colonoscopy. Sasa after hapo ndio nikaambiwa we will do more than just colonoscopy. Nikafanyiwa hiyo biopsy. After biopsy nikaambiwa ningoje majibu, wakanipigia simu. Tulikuwa in shock wakati daktari alituita ndani. Nilipatikana niko stage 3 naenda stage 4. It was a shock to the whole family.
Naam, kama vile tulivyowaahidi, wataalamu wenyu wako hapa. Today we have with us Dr. Gladwell Kiarie. She is a physician as well as a medical oncologist. Now, Dr. Kiarie is based at the Nairobi Hospital, where she has also been part of the board and chaired the board. And she is also the president of the Kenya Society of Hematology and Oncologists. Karibu sana, Dr. Kiarie.
Thank you very
We're honored
much,
to have you
Dr.
here.
Yes.
You're welcome. Now, CIC is our proud sponsor of today's show. When we think about medicine, when we think about healthcare, cost is one of the things that stresses us out the most. CIC has developed several plans to be able to support us on this journey. For the family, we have CIC Medisure, and for the older generation, for the older people who are looking into chronic illnesses and the ones we are wanting to screen more for the cancers, we have the CIC Seniors Plan. If you belong to a SACCO, a CHAMA, we also have a plan for you from CIC, so they're here to cover you from end to end. Now, Dr. Kiarie, karibu sana.
Yes, Dr.
We were listening to Martha and her story, and she's talking about the symptoms, the things that made her aware that something was indeed going wrong. For a very long time, she says just being put on laxatives, anapewa dawa za stool softeners. Is this something common that you see with patients you make a diagnosis of?
Yes, Daktari. In fact, her story sort of epitomizes the story of many Kenyans. And probably the most important thing to tell people is that early colon cancer is completely asymptomatic. You don't feel anything, you don't have any pain, you don't have any stool disturbance. And that is when we should diagnose it. Hence the importance of doing screening tests. But also in Martha's story, probably a heads up to clinicians is that we should have a high index of suspicion in people who repeatedly come to clinic with complaints of changes in bowel habits. She had constipation that seemed never to be resolving until she got pain. Yet in her story, nobody suggests that she do a CT scan or even get colonoscopy. And I didn't even hear her talking about blood tests because one of the other things that we find, or what we call a sign, is anemia. Because even if there is no obvious blood loss in stool, sometimes there is a little blood making our stool black in what we call melena. So a heads up also to clinicians and probably just education to the public so that they can also prompt their doctors to send them for some of these tests. Because as you have explained to us at the beginning of the show, it's the 5th commonest cancer. Probably it may be even a little higher because some of the diagnostics include colonoscopy, which is a little difficult to organize, and therefore probably many people never get to have a colonoscopy. Sometimes they come to hospital with bowel perforation, and therefore they are taken for emergency theater and surgery, and that's when the diagnosis is made, or they have a CT scan and end up having surgery, not going through colonoscopy. But usually, Daktari, those are later stages.
Now, please share your questions with us on our SMS lines 22422. Engage us on our socials. Our handles are at UlizaDaktari Citizen and at Daktari_Mengesa. Send in your questions and give us your names as you do so. Now, in my experience as a gynecologist, I see a lot of postmenopausal patients, and sometimes you pick up, either you're running, routine blood tests, you see that low HB, or occasionally, because I don't know if commonly when we are doing our routine screenings, do we ask for occult blood in stool? When should we start these screenings? At what age do you think it would be important to start, and who should be screened?
Thank you, Dr. Mengesa. Very, very good question. Now, routinely as people do their annual checks, even without any symptoms, as we've explained, doing a full blood count is one of the important things to do. And a change in what we call the microcytosis, which suggests that there is iron loss, and we lose iron by losing blood. And for example, your patients are postmenopausal, so they are not having periods. So they are not meant to be anemic. And that should be a big sign that probably this needs to be investigated. So the fecal occult blood test or the fecal immunohistochemistry tests are very good screening tests that are non-invasive. But of course, the gold standard is actually a colonoscopy. A colonoscopy is putting a tube up the rectum with a camera. And the benefits of colonoscopy are that if a premalignant small polyp is found, it can actually be removed, and therefore removing the risk of it progressing to a cancer. And two, of course, a diagnosis of an early cancer can also be made. So doing the fecal tests is important. They are very good, non-invasive screening tests that can hasten somebody to doing a colonoscopy if it's positive. But even if it's negative, it's very important for all people to have a baseline colonoscopy from the age of 45. And Daktari, I'll put a rider there in that there are people with a strong family history of colon cancer. Either they have a first-degree relative who's had colon cancer, your mother, your father, your brother, your sister. It's very important for you to go for a screening colonoscopy much earlier than the age of 45. The other thing is sometimes people with what we call inflammatory bowel conditions, for example, ulcerative colitis and Crohn's disease, also have a higher propensity to get colon cancer, and therefore their colonoscopy should not be tied to 45 years. But I guess when they have these inflammatory bowel conditions, they get colonoscopy done regularly. So a family history, certain genetic conditions, for example, people with what we call familial adenomatous polyposis or hereditary non-polyposis coli. These are people with polyp syndromes, and therefore they should have repeated colonoscopies to make sure that this is picked early when it starts developing into a malignancy.
Okay.
Yes.
So, Daktari ameguzia mambo kadhaa. We have talked about tests ambazo zinaweza fanywa kwa choo. So simply, it's a stool test. Yani utaenda hospitali, utoe sample ya choo, and in that stool test, we can be able to see if there's anything abnormal that can make us more suspicious that something could be going wrong.
Yes.
Haya, kuna pia mambo yale tumesema ya familia. Some things can be inherited, and some of these things include something called polyps.
Yes.
Now, polyps is something interesting that people are wondering, what are these polyps? Hizi polyps, sometimes wakifanya colonoscopy, they might not be cancer, but they might be what we're calling polyps. How would you say, what are these polyps? Zinakaaje, and what do they mean? Do they always mean cancer, or what other things might they indicate?
So, Daktari, a polyp, because we're talking about the cancer developing in the lumen or in the tube of the intestine, and therefore in that lining inside the intestine is where it starts to bud and to grow. So it starts like, we call it a finger-like projection. So it starts as a small pimple, then it continues to project out like a little finger, and then eventually it becomes like a rungu, where it has a head and then a stalk. That's a polyp. It is completely premalignant, because many of them actually progress and develop into cancer within a period of 10 years. Some of them are benign, they never develop into a malignancy, but it is not safe to leave them in the colon. So when colonoscopy is done, they are actually resected. I have many patients who on routine colonoscopy were found to have a polyp, or we were doing colonoscopy because their first-degree relative has colon cancer. We found a polyp, we removed it. And every year we do colonoscopy, we find a polyp and we remove it. Now, the beauty of this process is they never progress to develop colon cancer, and therefore they are cured by that screening colonoscopy that removes the premalignant lesion. So they are little growths, Daktari, in the colon. We call them finger-like projections, and they are very easy to remove during colonoscopy.
Okay, so I think you've seen the images, and we've been, you've understood now what we mean when we say polyps. Now, one of the things people are wondering about as well is when it comes to men, is there anything different that you would expect in terms of symptoms from men?
So, yes, Dr. Lauren. No, so men, there is a higher, among the numbers of colon cancer, there is more colon cancer in men. Now, we sometimes, but an equally high number in women. I wouldn't like people to mistake and think that only men should go for colonoscopy. The other problem we have with men is sort of the health-seeking behavior. And I think either because of traditional factors, African men are usually very averse to having colonoscopy and also having what we call the digital rectal exam, which sometimes doctors use to be able to diagnose the low-lying tumors that are near the anus or the rectum. So Daktari men are no different, probably because we can say there are more men than women who smoke and take high amounts of alcohol and probably have diets that have less fiber, probably don't drink as much water because, vegetables and roughage are very important in sort of the safe diets in preventing the development of colon cancer. And of course, avoiding obesity, which occurs equally also in postmenopausal women. As we grow older, we sort of have a propensity to eat more, to be sedentary, to add weight. So increased weight also is a risk factor for colon cancer. There is a very interesting association between constipation and development of colon cancer, because if stool stays in the gut, its relationship with the gut flora and also causing inflammation of the colon lining is thought to also predispose to malignant changes in the gut. And therefore, going to the toilet frequently by eating roughage, exercising, drinking good amounts of water is very important.
All right. Thank you so much, Daktari. Now, as we get into more interesting parts of this discussion, please send in your questions. I will be responding to them after the break.